video, we shall learn about asepsis routine to be followed at the time of entry into the NICU. Before entering NICU, one should remove all the accessories like rings, bangles, watch or wrist threads, socks and woolens. Hair should be tied up neatly. Nails should be properly trimmed, clean, and nail paint, if any, should be removed. One should wear shoe covers or separate foot cover designated for that area. Sleeves should be rolled at least 1 inch above the elbows. Hand washing is mandatory before the entry into the NICU. Perform 6 steps of hand washing for 40 to 60 seconds. Policy of gowning or use of sterile gown and autoclaved scrubs etc. should be followed as per the individual NICU or SNCU protocol. There should be a buffer zone beyond the door of the NICU or SNCU into which the visitors are not allowed without permission. Any person with infections like conjunctivitis, URI, diarrhea etc. should not be allowed to enter the SNCU or NICU. Avoiding overcrowding is must to prevent infection. Any hospital personnel who does not have a valid reason to be in the NICU should not be allowed to enter. Both the parents, that is mother and father, or a responsible guardian should be allowed to enter the SNCU and encouraged to participate in the care of their babies like performing KMC, sponging, weighing, feeding and diaper change. They should be trained regarding the basic NICU etiquettes and hand hygiene.
Let us learn how to clean the floors and walls of SNCU. Walls and floor should be preferably made of vitrified tiles with no cracks in between. Use phenol for routine cleaning of floors. Use surface disinfectant or damp cloth soaked in soap water for cleaning the walls. It is recommended to clean the floors once per shift and the walls once a day. Use a triple bucket technique for cleaning the floors of the SNCU. One bucket has plain water, second bucket has disinfectant solution in the form of phenol or any other surface disinfectant, and third bucket is empty for rinsing. Now dip the clean and dry mop in plain water and squeeze it properly. Then dip the mop in the disinfectant solution and sweep the floors. After sweeping, squeeze in the empty bucket kept for dirty water. Now dip in the plain water again, followed by disinfectant solution, and sweep the floor. Only wet mopping of the floor is to be done. High-touch surfaces like doorknobs, telephone, keyboard, which is present inside the SNCU, should be cleaned in every shift with a surface disinfectant. Thank you. We shall learn how to clean the radiant warmer. The control panel and the bassinet with walls of the radiant warmer come under high-touch surfaces. They need thorough cleaning and disinfection. All parts should be cleaned with soap and water at least once a day. When a warmer bed is empty, all parts including the bed, dismantled and cleaned individually with disinfectant before each new admission. Do not use alcohol-based solutions to clean the transparent panels. Wipe and disinfect the temperature probe using 70% isopropyl alcohol at least once a day. The sides of the bassinet and the bedding have to be cleaned when the baby is lifted off the bed for sponging or weighing. We shall learn how to clean the resuscitation equipment. Resuscitation equipment includes bag, mask, reservoir, oxygen tubing and laryngoscope with blade. All these parts should be dismantled and thoroughly cleaned in soap and water and thereafter rinsed with running water at least once a day. Remove the bulb present on the laryngoscope blade before cleaning and keep it aside. Once cleaned with soap and water, immerse these into 2% glutaraldehyde or Cidex solution. Laryngoscope parts are immersed for half an hour while the others are immersed for 6 hours. After removing from Cidex, wash thoroughly under running water and keep on a sterile tray or a sterile sheet to dry. Once dry, wrap them in a sterile sheet and keep for the next use. In emergency situation, if thorough cleaning is not possible before use, wipe the surfaces of the mask, patient end of the bag and the laryngoscope blade thoroughly with 70% alcohol swabs. Let us learn how to clean a suction machine. Suction can be central or foot operated. A suction machine has two main parts which should be cleaned. One is a suction jar made of plastic or polycarbonate and another is suction tubing made of plastic. The suction jar should be emptied and cleaned at least twice a day and whenever it is full in between. It should be cleaned with water and detergent solution and rinsed in running water. The sterile suction tubing should remain in its packing and the end meant to be attached to the suction jar should be connected. The suction tubing after use should be washed with soap and water and then dipped in 2% glutaraldehyde or Cidex for half an hour every day. It should then be rinsed with sterile water and dried before use. The suction tubing on a suction machine should be changed once a day and prior to use on a new baby. We shall learn how to clean the pulse oximeter. Pulse oximeter has the following parts: a power cord, main screen, extension cable, and a sensor probe. They are high touch surfaces and hence need thorough cleaning and disinfection. Always ensure pulse oximeter is turned off and the power cord is disconnected from the socket before cleaning. Wipe clean the power cord and the extension cable with a surface disinfectant containing glutaraldehyde. Clean the main screen using a cloth dipped in soap and water. Now use 70% alcohol to clean the sensor probe. Take special care to clean the buttons, knobs and screen in case of a touch screen device. Pulse oximeter should be cleaned at least once a day and whenever attached to a new site or a new baby. Let us learn how to clean the feeding utensils. For feeding the newborns, paladay, katori and cup should be made of material that can be cleaned easily like stainless steel, and they should not have any grooves or ridges on them. After feeding, the cup and the paladay should be washed under running tap water with soap for initial disinfection and to remove any particles of milk stuck on the utensils. Keep the utensil in the boiler with boiling water for 15 minutes. Note that the vessels must be fully covered by water and there should be no air bubbles. The utensils are taken out by a sterile Chittle forceps and placed in hot air oven for 20 to 30 minutes. The utensils are taken out of the hot air oven for use in a sterile manner after thorough hand washing. The units without a hot air oven should air dry the utensils after taking them out from the boiler. After drying, the utensils should be stored in a clean and dry place and used for feeding the baby after performing hand hygiene. We shall learn how to clean the phototherapy unit. Phototherapy units should be cleaned every day and prior to use on a new baby. Switch off the phototherapy unit prior to cleaning to avoid risk of electrical accidents. The entire unit, including the area with lamps, should be cleaned by a damp cloth dipped in soap water or surface disinfectant. The frequent touch surfaces like the switches and the control panel knobs should be disinfected with a disinfectant.